Ladies and gentlemen, I want to call the meeting to order. Thank you all for coming. Good morning. Before we go over the budget recommendations, I want to take just a couple of minutes and make a few comments and let you know that how much we appreciate the members of this subcommittee. They put in a lot of hours to come up with these budget recommendations, and I just want to say thank you to them publicly, and also to Tara, our budget analyst, who put in many hours to help us and been a tremendous help, as well as Martha and the other folks over in the budget office. We just want to say thank you publicly. We heard a lot of input from many of you out there. We listened and we tried as best we could to address as many of your concerns as we could in this budget. Now, it's not to say we have done everything that everybody wanted us to do, but we have made an effort to try to address as much as we could. So having said that, I'm going to go ahead and run through the budget, and I'm going to just hit the changes that we have had. Y'all have had your tracking sheets in the budget. You've had an opportunity to study this for some time, so I'm going to go ahead and move through this. And we have rules coming up at 9, so we want to be sure we don't get the chairman of the Rules Committee mad with us for overtime here. Under 17.1.9 and 1.10, this has to do with some funds that have been recaptured from contracts that we didn't need, and how the Department of Audits will be taking over Community Health's auditing. 1.11, this is a transfer from another area. It looks like an ad here, but I'll show you where it's just transferred up in a minute. 1.12 and 1.13 are both language. This just simply directs where we transfer from the Community Care Services Program for any additional savings that could go to slots. And then in 1.13, this is just authorizing the department to apply for the Section 1115 waivers if they need them. This will just give them some flexibility in the way they administer the programs. 17.4.4 eliminates some one-time funding from the 16 budget. Same with 4.5, and then 4.6 is an addition to for startup funds for 2 federally qualified health care centers. 4.7 is an addition for the Champions for Children's program. Many of you have talked to us about this. Is for those children who do not qualify for the Katie Beckett program. 4.8 is language, simply using existing funds to continue to operate the Rural Stabilization Committee that's been ongoing from last year. $7.2, this is just a reflects an adjustment for the growth in the Medicaid based on the projected need, and there's a slight change there just because of later information, more updated, better numbers. 7.3 is a slight change there in the funds to, for the increase in the Medicare Part D clawback payment we make each year. 7.8 is a cut there where we've recouped some funds that were in the budget last year for the change of ownerships for some of the nursing homes. All of that money was not needed, so we're able to take that back and capture that. 7.9, this is an increase for funding for the nursing home cost report. It's based upon the 2012 cost report with a 3% inflation addition. 7.10, this increases funds for the independent care waivers personal support. This basically would move those personal support hourly rates up to the same as the CCSP and the SOURCE program. 7.11, this increases funds for the reimbursement for the adult day health centers. It's a 5% increase. They have not had an increase since 1998. 7.12, this is a slight increase there in payments. Same thing with them. It's been for the OTs and PTs. It's been quite a while since they've had a rate increase. 7.13, this is another example of that with the, this is the language that allows the department to evaluate if long-term acute care hospitals can be enrolled in Medicaid in such a way that there would be no cost involved with that, and report back. The 7.14, this is the transfer that I mentioned earlier, that this went up to 17.1.11. 17.8.1, this is the growth factor for the Medicaid on projected needs. There's a change there because of later information in needs. 17.8.6, this is provide funds to increase reimbursement rates for select primary care and OBGYN codes to 100% of the 2014 Medicare levels. 8.7, this is a slight increase in our ambulance service for the advanced life support transport codes. This is like your strokes and your heart attacks and that sort of thing. They have not had an increase in quite some time as well. Language in 8.8, this just requiring the CMOs to pass on the full amount of the rate increases to the providers. 8.9, this is where we had some discussions about ADHD. This would be the department would evaluate a cost-saving study to see if better diagnosis of this would not be cost-effective and do better at treating those who need some help. 10.7, this is language also. This authorizes a pilot program for local school systems. This is under for their health care coverage for non-certificated people with the ability of the school system to opt back into the state health plan afterwards without penalty if they so choose. 10.8 is just recognizing that the state is continuing to fund its OPEB liabilities. 17.11.3 and 17.12.2, that's just a transfer of those funds to the Physicians Workforce Board to help them be able to better prepare the reports that they're required to do every year that are necessary to track the providers around the state. 17.12.3, this is it's going to be moved over to 17.15.4. We'll talk about that in just a second. Let's see here. 17.12.4, this is an add to Memorial Health Center in Savannah. After Grady, that's the second busiest level 1 trauma center in the state. We only have 2 emergency medicine residency programs in the state. One's in Augusta and one's in Atlanta. And they want to determine if they can set up a program there, and they're willing to put their own money to match with this to make that study happen and hopefully be able to establish a program there that will benefit the state. 17.15.2, this is the restoration of the dental loan repayment program that we had last year. That's been very well received. 15.3, this provides fund for a loan repayment program for physicians' assistants and nurse practitioners who agree to serve in rural and underserved areas. They would be able to be awarded $10,000 a year for up to 4 years to help offset their student debt. This 15.4, this goes back to the earlier, this is the Colquitt Regional Medical Center. It's $100,000 for them to do their recruitment program down there for their residency program, and with this they'll be able to draw down a couple of $100,000 in federal funds to go with that. They ought to be very pleased that that's going to happen down there for them. 17.18.3, just a small add. This is for additional rent that they have been relocated into some state buildings, and the building authority wants their rent paid. Public health, 38.1.4. This restores the cut that was there for the Georgia Cancer Information website. The 38.1.5, this is replacing federal funds lost for the Women's Health Program. 38.1.6, provide funds for the Positive Alternatives for Pregnancy and Parenting Grant Program. 38.3.7, this is funds for an ongoing contract to maintain the telehealth equipment in each county across the state. 38.5.3, this is increased funding for the Georgia Poison Control Center because of the additional workload they have all across this state. They serve all 159 counties. 38.5.4, this provides fund for the Georgia Poison Center for a telephone-based stroke support system that would reach out across the state to try to help people determine how best to treat a stroke patient and where they should be taken for the best results. 38.7.5, this is restoring that cut to the Georgia Comprehensive Sickle Cell Center. And then 38.7.6, this is funding for the Medical College for their Sickle Cell Center there in Augusta, dealing with the complexities of the disease and the increased demands on their work there. 38.12.5, there's a change there. This would be funding the 6th year. If you'll remember, there was going to be a 7-year phase-in over the whole harmless money for the counties in public health. This will be funding the 6th year and be 1 year left. And that, let's see. Okay, I want to back up. I went through here pretty quickly. I didn't emphasize this, but this is something that I think all of us need to be really pleased about. We had a lot of people who came and talked to us about trying to do something for the providers around the state who provided care, especially the primary care. And I mentioned to you earlier 17.8.6. This is $26 million to help bring those codes up to 100% of the Medicare level. This is something that's going to affect everybody all across the state. It's going to help some of our providers stay in business, and it's going to help those who need health care have access to get it. So I think we can all be proud about that, and I think once you see how this is going to help, you'll be pleased that we were able to do that. Well, that completes my explanation. Do we have any questions from the committee? We have a motion, second, do pass. Any discussion? All those in favor, please say aye. Aye. Any opposed? Thank you very much.